The title of my poster is Effectiveness and Real-World Materials Compatibility of a Novel Hydrogen Peroxide Disinfectant Cleaner. This study was funded by PDI. The background for this study is that current CDI control measures do not address spore shedding by asymptomatic carriers. Most of our efforts focus on infected patients who are the major risk factor for transmission of C. difficile, and we use bleach or other sporicidal products to decontaminate surfaces in their rooms. However, many patients who acquire C. diff colonization never develop symptoms, and those asymptomatic carriers can also shed spores, although the number of spores that are shed is relatively lower. In addition, many patients who previously had C. diff continue to shed spores and are also present a potential risk for transmission. In many hospitals, non-sporicidal products are used for all rooms other than CDI rooms. And there is evidence that use of sporicidal disinfectants in all patient rooms can be beneficial because it can reduce recovery of spores in non-CDI rooms. So this is a study in which we initially, during a period of time, used a quaternary ammonium disinfectant. Those bars are shown in red. And as you can see, that we recovered a lot of C. diff spores from patient rooms of non-CDI patients during that period when we were using a product that does not kill C. difficile spores. And in contrast, the green bar shows what happened when we switched to a spray bleach disinfectant, which does have activity against spores. And you can see a dramatic reduction in contamination and potentially a reduction in risk that for the subsequent patient admitted to those rooms. So there is a good rationale for using sporicidal disinfectants for all patient rooms. However, there's a need for improved sporicidal disinfectants. So many of the current sporicidal disinfectants that we use have limitations that discourage widespread use. For example, bleach products are caustic to surfaces and are irritating to many personnel. So Hypercide disinfectant from PDI is a new hydrogen peroxide-based spray or wipe disinfectant. It generates low levels of peracetic acid, which kills spores while it's being used. And it's EPA registered for many non-sporicidal pathogens with a 1-minute claim, and for C. difficile spores with a 5-minute claim. So the objective of our poster presentation was to evaluate the effectiveness and real-world materials compatibility of hydrogen peroxide disinfectant in comparison to 3 other disinfectants that are commonly used in hospitals. So the disinfectants that we studied included Hypercide, Clorox germicidal bleach, Oxycide, and Oxyvir. We used the ASTM quantitative carrier disc test method with an exposure time of 1 minute, so that the disinfectant's activity was allowed to occur only after a period of 1 minute. The test organisms included MRSA, Clostridium difficile, carbapenem-resistant Escherichia coli, or E. coli, also known as CRE, and Candida auris, which is an emerging multi-drug resistant fungal pathogen. A 3-log reduction was considered adequate, and materials compatibility was tested by applying the disinfectants on a bedside table and on a fluid-resistant mattress. So these are the results for the most important part of the study, looking at the effectiveness of the disinfectants. And the major finding was that Hypercide was equivalent to Clorox germicidal bleach and Oxycide, the other commonly used sporicidal products, in killing each of the pathogens tested. And excellent activity against C. difficile with essentially complete elimination of spores on the test items. And in contrast, Oxyvir had excellent activity against MRSA, CRE, and Candida auris. It had only a 2.6 log reduction in C. difficile. However, that product is not registered as a sporicidal product, so we would not expect it to have that great of a reduction in C. difficile spores. And then when we looked at materials compatibility, we found that bleach caused mild fading and loss of pliability of the mattress that we tested after 130 repeated applications of the product. Although it's not well seen here, you see some loss of color and fading of the mattress on the bleach arm. And when you palpated the mattress, it had become it had loss of pliability and was becoming a bit rigid. The other disinfectants had no appreciable adverse effect on the mattresses. So our conclusions from this study were that the new hydrogen peroxide-based disinfectant was effective against vegetative bacteria, Candida auris, and C. difficile spores with only a 1-minute exposure time. And it was as effective as other commonly used disinfectants that may have some potential disadvantages. The disinfectant did not cause adverse effects on a bedside tabletop or on a hospital mattress. At this point, further studies are needed to evaluate the effectiveness and materials compatibility of the disinfectant in healthcare settings, and in addition to include some studies that assess the impact of using a sporicidal disinfectant everywhere in the hospital on rates of C. difficile infection. Thank you.